Indonesia has become the first country in Asia to exceed 1 million COVID-19 infections. The milestone has been passed this evening after the reporting of more than 13,000 new cases. At the same time, hospitals are on the brink of collapse due to the overwhelming number of patients.
Indonesia hits a grim milestone as the country records 1 million COVID-19 cases. It comes less than a year since the first cases were confirmed in March. But experts say the true number of infections is believed to be much higher than the official tally due to the low testing and tracing rates. That works out to about 1 in every 270 people in Indonesia. Hospitals are feeling the brunt as ICU beds and isolation rooms are being rapidly filled up. Occupancy levels have exceeded an average of 70% capacity nationwide. Jakarta remains the hardest hit, reaching the 86% capacity. Both levels are above the recommended bed capacity set by the World Health Organization, capped at 60%. Even the medical staff are feeling the pressure.
Tiap hari kami merawat rata-rata di atas 95 pasien, sehingga kalau 95 per 156 itu udah hampir 80-an%, di atas 80% ya. Dan itu sudah warning udah tingkat yang bahaya. Malah kita pernah merawat pasien di atas 120.
But it's not just hospitals that are facing bed shortages. The world's most populous Muslim country is also running out of public burial grounds for COVID-19 patients. Several burial areas across the country are already fully occupied. Indonesia remains the worst-hit country in Southeast Asia, following the 1 million milestone, along with the over 28,460 deaths.
Sebenarnya mengkhawatirkan ya, karena kan 1 juta itu bukan jumlah yang sedikit gitu. Berarti dari situ diketahui tingkat kesadaran warga sendiri itu masih rendah gitu. Mungkin udah ada beberapa yang mengikuti protokol, tapi ada juga nih yang masih bandel.
Sangat mengkhawatirkan. Ya mungkin karena kurang kesadaran masyarakat kali ya. Sebenarnya bukan nggak sadar, mungkin entah nggak mau tahu atau nggak peduli. Kayak pakai masker, harus cuci tangan itu harusnya wajib ya. Cuma di kota pun sekarang masih banyak yang nggak sadar harus kalau pakai masker itu wajib.
To fight the pandemic, Indonesia has rolled out a mass vaccination drive this month. Some 179,000 doses of China's Sinovac vaccine have already been administered. The government aims to inoculate about 70% of the population by March next year.
Saiful Bahri Ismail joins us live now from Jakarta. Saiful, a grim milestone for Indonesia. What went wrong?
Well, Dawn, it's a grim milestone indeed. It is significant as it gives Indonesia an opportunity to reflect again on how it has been dealing and managing with the health crisis. Now, Health Minister Budi Gunadi Sadikin spoke live on the government's YouTube channel this evening with regards to Indonesia crossing the 1 million COVID-19 cases. Mr. Budi said it is a moment to grieve for those who have died from the disease. And secondly, it's also time to be more aware and to work even harder to fight the virus so the sacrifices of those who have died, especially the health workers, do not go to waste. Mr. Budi said it's important to slow down the rate of infection, that is to flatten the curve. It has been nearly 1 year since Indonesia announced its first cases of COVID-19, and the country is still on the first wave of infections and has not been able to flatten the curve. Now, this needs to be done so that the healthcare system does not collapse, and it will give authorities more time to respond to the disease. Now, to do this, Mr. Budi urged all Indonesians to be more disciplined and adhere to the COVID-19 health protocols. And on the part of the government, Mr. Budi said, authorities will work even harder on testing, tracing, and isolation efforts. Now, earlier you asked what went wrong in Indonesia. One critical issue is how the country has been doing testing. The World Health Organization has recommended 1 test per 1,000 population per week. Now, that means Indonesia needs to do 267,000 tests per week. Indonesia has managed to increase its testing capacity to meet a WHO standards, but last week, Mr. Budi admitted that the government had been conducting testing the wrong way. Now, he cited himself as an example. He said he had to be tested before every meeting with President Joko Widodo. Mr. Budi explained it shouldn't be like that. He said testing should be done for epidemiological purposes instead of private matters. Mr. Budi added that the ones who should take the test are suspected cases, not people who want to go on holiday or meetings.
And Saiful, how is the country going to deal with the shortage in hospital beds that it's facing?
Well, one way authorities are dealing with the shortage of hospital beds is to recommend those who are carrying the virus but without symptoms to self-isolate. Now, this is part of the effort to keep hospitals from running out of beds for COVID-19 patients needing further treatment. Now, the Indonesian Hospital Association said not everyone with COVID-19 needs to be treated at the hospital as long as they manage to self-isolate. The association also sees a possibility of sending recovering COVID-19 patients to a self-isolation facility to make room for other patients. Now, to avoid misunderstandings over the bed capacity limitations, the association has been working together with hospitals to educate the public about the situation. Apart from that, the Health Ministry has also committed to increasing hospital capacity by recruiting more nurses and volunteer doctors. Now, the Jakarta Health Agency has also planned to add more COVID-19 referral hospitals in the capital city. The selected hospitals would have to make several preparations beforehand, such as designing a zoning system to separate COVID-19 patients from other patients. The agency said there needs to be another facility for COVID-19 patients to separate them from the regular ones.